Hey guys, this is Dr. Sharanya Reddy. Welcome to my channel Dentistry in Detail, where you can learn dentistry from basics and build strong base in the subject. In this video, we are going to cover Norma Frontalis. In Norma Frontalis, we are going to study the anterior aspect of the skull. This is how the skull going to look from the anterior view. Coming to the shape, it is oval in shape, and you can see it is wider above compared to below. And coming to the bones, you can see this is the frontal bone that forms the forehead, and these two are the nasal bones that forms the bridge of the nose, and here this is the zygomatic bone that forms the bony prominence over the cheek. This part is the zygomatic bone, and here this part is maxilla that forms the upper jaw, and this is the mandible which forms the lower jaw. Norma frontalis is studied in 4 parts. First one is the frontal region, second one the orbital opening, next is the anterior bony aperture of the nose, and the last one is lower part of the face. Now let us start with frontal region in the Norma frontalis. In the frontal region, above the medial part of the each orbit, we can see one round a curved elevation, and these curved elevations are known as superciliary arch. If we talk about this orbit, so the part which is close to the midline is known as the medial part, and the part that is away from the midline is known as lateral part. Similarly, for this orbit, this part becomes the medial and this part becomes the lateral. So on the above the medial part of the each orbit, we can find one curved elevation known as superciliary arch, and these are more prominent in males. Above the superciliary arches, we can find the rounded elevation on each side, and these are known as frontal tuber, and these are more prominent in females. And coming to this, these two are nasal bones, and this is the root of the nose. So these two nasal bones are interconnected to each other by internasal suture. And if you see here, this is the frontal and this is the nasal, so this becomes the frontonasal suture. This is nasion, which is the median point at the root of the nose. That is, the internasal suture is meeting the frontonasal suture at the median point on the root of the nose. Between the two superciliary arches, we find one median elevation that is known as glabella. So in the frontal region, we can find one curved elevation above the medial part of the each orbit, and those are known as the superciliary arches. And above the superciliary arch, one more rounded elevation is known as the frontal tuber, and between these two superciliary arches, one median elevation is present that is known as glabella, and this is the nasal bone. These two nasal bones are connected by the internasal suture, and at the root of the nose we can find the frontonasal suture, that is between the frontal bone and the nasal bone, and the median point on the root of the nose, that is where the internasal suture meets the frontonasal suture, we find a median point that is known as nasion. Coming to the orbital openings, each orbit is quadrangular in shape, that is, it has 4 margins or walls. And if we take this left orbit, this is the supraorbital margin, this is the infraorbital margin, and this is the lateral away from the midline, and towards the midline this is the medial orbital margin. The supraorbital margin is formed by frontal bone. You can see here, this is the frontal bone, so the supraorbital margin here, it is formed by frontal bone. And if we divide the orbit into 3 parts, this becomes the medial 1/3 and this becomes the lateral 1/3. So at the junction of this medial 1/3 and the lateral 2/3, we find one notch that is known as, that is this one. This notch is known as supraorbital notch or supraorbital foramen. And infraorbital margin, this is the infraorbital margin. As you can see here, medially you can find maxilla and laterally zygomatic bone. This is the zygomatic bone and this is the maxilla. So infraorbital margin is formed by zygomatic bone laterally and the maxilla medially. Lateral orbital margin, this is the lateral orbital margin, and this is the zygomatic bone and this is the frontal bone. So the zygomatic bone, projection of this zygomatic bone towards the frontal bone is known as the frontal process of zygomatic bone. This is the projection of zygomatic bone towards the frontal bone, and the projection of the frontal bone towards the zygomatic process is known as the zygomatic process of the frontal bone. So this is the lateral orbital margin. You can see here below the zygomatic bone, this projection of the zygomatic bone towards the frontal. So below it is lateral orbital margin is formed by the frontal process of the zygomatic bone below, and above you can see the frontal bone is projected towards the zygomatic bone. So this lateral orbital margin is formed above by the zygomatic process of the frontal bone. So similarly, medial orbital margin, this is the medial orbital margin, and you can see above it is formed by the frontal bone, and below you can see here the maxillary bone, and this maxilla is projected towards the frontal bone. So this becomes the frontal process of maxilla. So the projection of, this is the projection of maxilla towards the frontal bone. Projection of maxilla towards the frontal bone is known as the frontal process of maxilla. So medial orbital margin is formed by frontal bone above, and below it you can see on the medial side one bone which is known as the lacrimal bone, and the elevation on this bone is known as the crest, lacrimal crest. So it is medial orbital margin is formed below by the lacrimal crest of the frontal process of the maxilla. So supraorbital margin is formed by the frontal bone, and at the lateral at the junction of the medial 1/3 and the lateral 2/3 you find one notch which is known as supraorbital notch or the foramen, and this is the infraorbital margin. It is formed by the zygomatic bone laterally and the maxilla medially, and this is the lateral orbital margin. Above you can see the frontal bone is projected towards the zygomatic bone. So this is the zygomatic process of the frontal bone. So above it is formed by the zygomatic process of the frontal bone, and below this is the zygomatic bone. It is projected towards the frontal bone. So below the lateral orbital margin is formed below by the frontal process of the zygomatic bone, and on the medial side of the orbit you find one lacrimal bone, and and the elevation on the lacrimal bone is known as lacrimal crest. So medial orbital margin is formed above by the frontal bone and below by the lacrimal crest of the frontal process of the maxilla. As this maxilla is projected towards the frontal bone, we call it as the frontal process of the maxilla. So below it, the mesial orbital margin is formed by the frontal process of the maxilla. Anterior bony aperture of the nose. This is the anterior bony aperture of the nose, also known as the piriform aperture. It is pear shaped and wider below, narrow above. And coming to the boundaries, you can see here this is the nasal bone. So above it is bounded by the lower border of the nasal bone, and below you can see here these are the curved margins on the lower part of the piriform aperture, and these curved margins are known as the nasal notch. So a piriform aperture is bounded above by the lower border of the nasal bone and below by the nasal notch of the body of the maxilla on the each side. And coming to the articulations of the nasal bone, so this is the nasal bone. You can see here the internasal suture. So anteriorly it is articulated with the opposite bone at the internasal suture, and posteriorly, that is behind this nasal bone, we can see this is the maxilla, right? So we have already discussed that this maxilla is projecting towards the frontal bone. So this projection is known as the frontal process of the maxilla. So posteriorly it is articulated with the frontal process of the maxilla, and superiorly this is the frontal bone. So superiorly it is articulated with the frontal bone at the frontonasal suture, and inferiorly up, that is at this part inferiorly, we can see the upper nasal cartilage is attached to it. So apart from this, on the lower part of the piriform aperture, medially we can find one sharp projection, and that sharp projection is known as anterior nasal spine. And this is the internasal suture. At the lowermost point of the internasal suture, this point is known as renion. In the lower part of the face, it contains the zygomatic bone, and on the lateral surface of the zygomatic bone, we find zygomaticofacial foramen. And coming to the maxilla, this is the maxillary bone. In the maxillary bone, we can find the anterior nasal spine, that is the sharp projection on the lower part of the piriform aperture, and these are the nasal notches on the body of the maxilla, and this is the infraorbital margin of the orbit. So 1 centimeters below this infraorbital margin on the body of the maxilla, you find the infraorbital foramen. And apart from this, you can also find the incisive fossa above the incisor teeth, and also the canine fossa lateral to the canine eminence. And now, apart from these, coming to the process of the maxilla, we find 3 processes of maxilla. What are they? See, this is the maxillary bone, right? So the maxillary bone projecting into the frontal bone, zygomatic bone, and some part of the maxillary bone also bears the sockets for the alveolar process. So this process is known as the frontal process of the maxilla, as it is projecting towards the frontal bone, and this part towards the zygomatic bone is known as the zygomatic process of the maxilla, and this maxillary bone that bears the socket for the upper teeth is known as the alveolar process of the maxilla. Now coming to the mandibular bone, it forms the lower jaw, and this is the mandibular bone. It contains the upper border and the lower border, and the upper border lodges the lower teeth and the lower border is rounded. At the midline of the body of the mandible, that is here, we find symphysis menti, and the symphysis menti divides and forms one triangular eminence which is known as mental protuberance, and if we see, this is the triangular in shape and this is the base. At the center of the base is depressed, but on either side it is raised. So these raised elevations are known as the mental tubercle, and from this mental tubercle we find one line running upwards and backwards onto the ramus of the mandible, and this is known as the oblique line, and between the two premolars we find one foramen known as mental foramen. So in the lower part of the face we find zygomatic bone, maxillary bone and mandibular bone. Zygomatic bone, it is the bony prominence over the cheek region, and mandibular bone, it forms the upper jaw, and maxillary bone, it forms the upper jaw, and the mandibular bone, it forms the lower jaw. So this completes Norma Frontalis. I hope you understood the topic. If you liked my video, give me a thumbs up and subscribe my channel so that you won't miss any of my videos. Have a nice day, guys.